there, private practice owners. In today's video, I'll review 26 health insurance terms you should know before accepting insurance and submitting claims in your private practice. And if you're new to insurance billing, check out our free on-demand insurance billing course for therapists. I've included the link for you to enroll below this video. And before I dive in, if you're watching this on YouTube, subscribe. And if you're already subscribed, click on the bell icon to get notifications about more videos like this one. Let's get started. Here are the 26 terms you should know. Number 1, credentialing. So credentialing is the vetting process used by health plans to verify your practice, your skills, and license. So if you plan on contracting with health insurance and accepting clients of this particular insurance, you have to go through this process. Another term is contracting. So once the insurance approves you to be on their panel, you will have this formal agreement between you, the provider, and the health plan. CAQH term stands for Council for Affordable Quality Healthcare, and it's a non-profit alliance consisting of health plans and related healthcare professionals. They basically maintain a provider credentialing database that most insurance companies use in credentialing and recredentialing process. So if you decide to contract with them, you're gonna log into this website and provide all of the paperwork. Another term to know is contracted rate. So this is the amount that refers to the amount of insurance company agrees to pay you for your services as an in-network provider. So this generally means you will receive your contracted rate minus any client copay, co-insurance, or remaining deductible amount. Another useful term to know is in-network provider. So in-network means that you are fully credentialed and paneled by a particular insurance company or payer. Basically, you are able to accept referrals for clients who have this type of insurance. Now, out-of-network provider means that you are not a fully credentialed provider for a particular insurance company or payer, and if you choose to see someone with insurance that you're not a provider for, any claim you submit will be denied. The exception to this is if a person has out-of-network benefits. Claim is another basic term you should know. So claim is essentially the bill you submit to insurance company or payer. Most claims are submitted in a specific format that follows the CMS 1500 format. And claims may be submitted electronically or via a hard copy, but nowadays most insurance companies actually require electronic version. CMS 1500, also known as HCFA form, is a standard paper claim form used to bill Medicare and Medicaid. Clean claim is another term you should use. It's basically a claim that is clean when it contains correct and complete information to be processed by the insurance company. So any missing or incorrect information can result in rejected or denied claims. So clean claim means you basically have all of the required information in all of the required boxes on the form. Denial. A denial of payment occurs when the claim submitted doesn't meet the company's guidelines for payments. And denials can happen for any number of reasons, from an incomplete claim to client's benefits being exhausted. Administrative denial is another term. So these types of denials are generally the result of issues such as lack of benefits, lack of authorization, or incorrect or incomplete claim. Depending on the specific reason for denial, these denials are generally not eligible for appeal, especially if it's not related to the benefits issue. Some companies may allow you to resubmit the claim, but if the client, for example, didn't have active insurance when you saw the client, then there's nothing you can really do. Another type of denial is clinical denial. These denials usually stem from a question of medical necessity or level of care. And most of the time, these are generally eligible for appeal and may require the submission of clinical documentation to support the claim, or what's commonly known as the clinical review between the provider and the company's clinical or medical reviewer. Appeal is another term that's very handy, and appeal is the process of requesting that a denied claim be reconsidered for payment. And each company has a specific process for requesting an appeal. Be aware that not every denied claim is eligible for appeal. Again, in general, claims denied for clinical reasons are usually accepted. But sometimes administrative reasons like expired benefits or no benefits for service are generally not eligible for appeal. So be sure to read your contract and the company's claims guidelines. These are usually found in the provider manual or website. Benefits, another handy term. So benefits are services that the insurance plan will pay for and at what rate. Benefits are not your contracted rate. They designate the member's responsibility in the form of deductibles, co-pays, and co-insurances. Out-of-network benefits. Some plans allow their members to see clinicians who are not fully credentialed. The allowable benefits are usually lower than if they see someone in network. And eligibility for out-of-network benefits is not automatic. So you will still need to possibly get the pre-authorization and submit a claim. And payment amount is based on the person's out-of-network benefits. Another term is eligibility. Basically, it refers to the date of the client's benefits become effective. So any claims before that date would not be eligible for payment. Prior authorization is another term you might have heard, and sometimes it's referred to as pre-authorization, which means that you have to get authorization from the insurance company before providing a particular service. So always check on that before seeing your client. Check with the insurance if you need to have one, what's the process, what paperwork they need from you. Balance billing is another term. This is the billing of a client for the difference between what insurance pays you and your standard rate. So in general, balance billing is prohibited if you are an in-network provider for the insurance. Sometimes you may be able to balance bill if your client is using out-of-network benefits, but always check. Deductible. This is the amount the client must pay before their benefits begin paying. So this varies, from insurance to insurance. For some services, the deductible may not even apply. So always check on this with the insurance. Copay is another term that you might heard. This is the portion of the fee that the client owes for a service. And again, a copay is not a deductible and it's not included in deductible. So again, copay amounts vary from plan, by service, and they vary by insurance company. Another useful term to use is a coordination of benefits, COB. This is when a client has more than one insurance, and coordination of benefits is how the two plans basically work together and which one to bill for which services. CPT codes, current procedural terminology, is the standard set of 5-digit codes used to designate the services provided. Your contract will specify the codes you're authorized to use for billing. And CPT codes were developed by American Medical Association, and that's where you can find the codes. Diagnostic and Statistical Manual of Mental Disorders, DSM. So for mental health professionals, DSM is the standard set of criteria used to diagnose mental disorders. Now, the DSM is not the same as ICD-10, but as mental health provider, you will be using both. So DSM to basically diagnose the disorder, and then ICD-10 diagnostic codes to report the diagnosis on the claim. And the three last terms you should know are electronic funds transfer, ICD codes, and superbill. So electronic funds transfer, EFT, is a method of payment that insurance companies use to pay claims. Payments are sent electronically directly to the bank account you designate, basically. ICD-10 codes are the current international codes used for specifying a disease or disorder, and they're not the same as CPT codes, and they're not the same as the DSM codes, but you will use the two to coordinate. So ICD-10 codes represent diagnostic codes. And finally, our last term is superbill. So a superbill is a document that you provide to your client who wants to try and seek reimbursement from their insurance company for the fees they have paid you. It's not a claim that you submit to the insurance company, and superbill contains much of the same information that you might find on the claim, from including a diagnostic code and service code along with the client's demographic information. So most of the time superbill is used if you are out of network provider, or maybe you're waiting to be credentialed and you have a client who wants to come to your office and basically will pay you up front with cash, and then you will provide the client with the superbill. Then the client himself or herself will take the superbill and submit with health insurance. There you have it, 26 health insurance terms you should know. I hope you found this video useful. Let me know by clicking the like icon, and I've included the link for you to enroll in our free on-demand insurance billing course for therapists below this video. Thank you for watching, and see you next time.